Okay, so let's start. Good evening, everyone, and welcome to today's seminar, which is about public health and COVID-19 in Burkina Faso. My name is Emma, and I'm the president of the UN Association for Kalmar, Öland. I don't know if anyone else in the board would like to introduce him or herself.
Yes, I could say a few words. My name is Marie Johansson, and I'm the secretary of the same association in Kalmar, Öland. I'm also a researcher. I'm researching on climate change in the agriculture sector. Thank you.
Thank you. Felicia, do you want to introduce yourself shortly?
Yes, I'm also in the same organization, and I'm responsible to encourage young people to care about the human rights.
Okay, great. Okay, so this discussion, I will continue. This discussion will be about 40 minutes long, where I will ask 6 questions to Dr. Kaboré. And after 4 minutes, we will open the floor for questions from you guys. Also important to note that this session will be recorded. Some people are interested but cannot join us today because of their busy schedule. I hope that everyone is okay with that. If you would like to be anonymous, please write your question in the chat box. Otherwise, you can just raise your hand and we will make sure to note the order of the questions that came in. Also, if you feel more comfortable with asking questions in Swedish, you're more than welcome to do so, and we will translate the questions to English. All right, so welcome, Dr. Kaboré. Thank you so much for being here today. So, hello.
Hello, Emma. Thank you for having me. Hello, everybody.
Thank you. It's really nice to have you here. So could you please start by introducing yourself?
Okay, thank you. My name is Ahmed Kaboré. I'm originally from Burkina Faso, and I have a background in public health. I was trained in the United States, where I have a bachelor in community health, a master's in epidemiology, and PhD in community health. And I moved back in Burkina Faso back in 2016, where I'm teaching at the largest university Zerbo in the capital city. Yeah, so, and I'm specialized in behavioral health. Thank you.
Okay, thank you. That's nice. Okay, so I will start with the first question. What would you say are the main public health issues in Burkina Faso?
Okay, thank you. Burkina Faso, public health issues that we can put to the table are infectious diseases. In Burkina Faso, we still have, we're still battling with infectious diseases like diarrhea and infections due to hygiene, infections like cholera, malaria, yeah, malaria is killing more than anything right now in Burkina Faso. And in addition to the infectious diseases that we have in Burkina Faso, we are dealing with non-communicable diseases. Burkina Faso, the country is actually fighting with pathologies like diabetes, high blood pressure, and anything like cardiovascular diseases are like main concerns in Burkina Faso. and tertiary care is like before the population in Burkina Faso was like very young, but now people are aging, so we're starting to have diseases that we didn't used to have in Burkina Faso.
Okay.
Yeah.
So it's a double burden.
Yes, we have. We are dealing with the double burden of the disease in right now.
Okay. And then came Corona also.
Yes, and Corona made its way in Burkina Faso, and like the other countries in the world, we are dealing with it. Yeah.
Yeah, of course.
Mm-hmm.
Okay. So if you want to add something else, or I will go for the next question.
I mean, yeah, I wait to see, the questions you will ask. If at the end, I feel the need to add some elements, I will.
Yeah, of course. Yeah. So how would you say, according to you, that Corona has affected the society in Burkina Faso in many different ways that you can come up with?
Okay. Corona, we had the first case back in May 2000, March 9, 2020. That's when we had the first case in Burkina Faso, and it affected the relationship between leadership and society. Yeah, because the way Corona made came in the country, the common Burkinabe view Corona as people traveling, people view Corona as white people disease. It wasn't a concern for Africans. And because at the beginning, we only had a government official tested positive for the disease, so people that you see on the street is not a concern for them. So that's how Corona came in Burkina Faso, and it affected the way we function, because we are very like we usually we are touchy people. Touchy people, yeah. We can take like 15 minutes to greet each other, to ask how is the family. But now with Corona, we're starting, a new way of life where we have to use the fist to greet each other. And sometimes it's not well viewed. Like when you go to a place where people don't see Corona as an issue, if you don't want to shake their hand, they will tell you. If you don't want to do it, don't come to them. So it's like it brought another view where rich people are dealing with the disease, and poor people are like going back. Because when I say going back, we had a curfew in Burkina Faso for about 2 weeks, and we closed like all the big markets in Burkina Faso, knowing that most of the people in Burkina Faso are leaving from type of job where they go to the market, sell their merchandise to feed their families. So people actually didn't believe the disease even being in Burkina Faso.
Okay.
Yeah, they were like mistrust. People were thinking the government was making a lot of talk about Corona just to bring foreign aid in the country. But actually, we didn't have Corona in the country. So that's how the population, viewed the disease. And when the vaccine came in, everything, like right now we have people, the vaccine was not available. Everybody was looking for the vaccine. Now the vaccine is available in the country. and is like the government is actually chasing people to come and get vaccinated. So this is like the paradox, because we wanted something, now is here, and people, there are a lot of rumor talking about the vaccine is the European and American way of reducing the African population. So there's a lot of talk about the vaccine in Burkina Faso, and it's affecting everything. So, but when you go up on the society, like a government official or university professors, we are dealing with corona. But when you go to the bottom of, you know, like the scale, people actually don't care about the disease. So that's how bad it is.
Okay.
Yeah, people don't care. They live like the disease is not there. The corona never existed in Burkina Faso. People still go to the bars, they go to restaurants, they still have funeral where they shake each other hands and do everything that they used to do. Yeah, like, but people like myself, we know for sure that the disease is there, and the disease can cause a lot of damages. So we take in precaution. But when you go down, people don't actually care about corona.
Okay, so there are still some people who believe that corona doesn't exist still?
Yes.
Okay. Interesting. And why do you think that people are suspicious about the vaccine? Why are some people against it?
Why they are suspicious about the vaccine, I think when you take malaria is killing more than corona. Malaria is killing more than COVID-19. But still, we are still looking for vaccine. I know, you know, WHO just approved a vaccine, you know, for malaria, but it was long due. When you take corona, we had corona for about 2 years and we have a vaccine. So African people think that, you know, it's not fair. We have been dealing with malaria for so many years without a vaccine, and corona came just 2 years and we have a vaccine. So people are thinking maybe this is not, there's something fishy about this vaccine. Yeah, because you know, and we have over here, people are so focused on Facebook. It's kind of funny, but in Burkina Faso, the use of the social network like Facebook, Instagram, and you know, and other platforms are very, very high. You take from college students to high school students to, you know, like people working in the market, all kind of level in the social group in Burkina Faso. Everybody is using Facebook or one type of social network, and that's where they get their, you know, their information about the vaccine. And we have a lot of information. Some people will show, you know, where they will like actually a white person will, you know, like fake to get a vaccine, and then they will vaccinate like a black person. And when they see stuff like that, it's, you know, for us, I know it's fake news, but people, they don't see it as fake news, and they actually live by that. So Facebook is actually making things worse. Yeah, it will take a lot because that's where they get the information from. Yeah, and you can see all kind of information also. Yeah, so and that's people also share videos about the effects of the COVID vaccine also, and it will scare people off and say, no, let's not take the vaccine. Yep.
Even if it happens, even if it's there, I mean, there are some side effects about it, but maybe it's not like, it's a very minimal, minimal cases. I mean, it's not that, it's not majority of people who get side effects. Yeah.
Yeah, I mean, when you take when you take the way people react to information, anything that you see on Facebook, people think is the truth. So that's the funny thing. So the vaccine, every day you get some fake news about the vaccine on Facebook, and it's coming from I don't know where.
Sorry, I forgot to record. Sorry.
So
Yeah.
I don't know where, but it's actually affecting the way people react to the vaccine. Yeah, because we had AstraZeneca that came. People, were like there were a lot of polemic, around that vaccine, and then we had Johnson and Johnson. We had the Chinese vaccine. So everything that gets on the ground here, we will have something about it. Yeah, and that's how rumors are built, and people go take it really, really serious.
Okay. Yeah, interesting. So you would say that the COVAX campaign in Burkina Faso or other COVID-19 vaccine campaigns hasn't been that effective?
No, it's not effective.
No.
Even when you take the healthcare system, you have medical doctors that still doubt that they don't want to take the vaccine. So if, for instance, your doctor doesn't want to take the vaccine, how would that affect you as a patient? Yeah, because you take the doctor is like the highest level of training that you can get. And if that person doesn't trust the vaccine, and the person has an impact, when you go to the doctor and your doctor tells you that, oh, I don't trust the vaccine, don't do it. So I go home and I tell all my neighbors, don't go get the vaccine because my doctor said so. And then the neighbors will go tell other people, don't do it because I had somebody's doctor, blah, blah, blah. So it's like spreading really, really fast. And coming from a doctor is, is so meaningful. So that's why we have issues like getting people on board. Right now, I don't even know if we have more than 2% of the people vaccinated.
Wow. Okay.
Yeah, so that's crazy. And the funny thing, the school just started in October, so we will have a lot of new cases that will come because kids, what they do, they spread the disease. So that's what they do best. Okay, and yeah, so people don't trust the vaccine, and not even those if you've never been to school and you don't trust the vaccine, is not hurting compared to someone who actually been to school for like 8-12 years and will go and spread that information, because people will come to me. Like, for instance, my neighbors, I had like four of my neighbors living right next to me. They came together and asked me, okay, we heard that you are a university professor. What can you tell us about the vaccine? Let's say, for instance, if I had the argument that the vaccine is no good, you don't want to do that. You don't want to try but most of them were like hypertensive and have like, diabetes. So I told them, okay, you don't mind going to get like Hep B vaccine, hepatitis B vaccine. You don't mind going to get like like a meningitis, the vaccine for meningitis and all those kind of stuff. Why Corona is causing so much trouble?
Yeah, I've been wondering that also, because it's been so natural to take all kinds of other vaccines as a child, but and also like now when you have to travel, for example, to Africa, you have to take the yellow fever, and it's totally normal. But when it comes to the COVID-19 vaccine, it's creates so much reactions from people, and it's not just in Africa. I'm gonna say it's all over the world, this reaction, because you can see like manifestations or demonstrations in Italy and in France about not getting vaccinated, and these people has been in lockdown for many months, many times, but still they are arguing against the vaccine. So I wonder why is it like this? Yeah, it's interesting. Okay, so I will go to the next question. So in relation to what we have discussed, the corona disaster has opened up for new discussions. Those of the pessimist view will argue that crisis make bad things worse. While those of the optimistic view will argue that crisis might lead to fundamental changes in society, but in a positive way. Would you say that you are more a COVID-19 pessimist or rather an optimist?
I think I would say I'm optimist.
Yeah.
I'm optimist because I know you probably aware of what we're dealing with in Africa. Like when you have a president that is sick, they will take a flight to go to Europe and get a care, like, get treated over there. But since Corona started, Europe was like, booked up with the crisis dealing with coronavirus. So it actually pushed the African leaders to actually develop the local healthcare system. Yeah, because if things goes wrong, you will be treated in your local country. So you have to take care of it. Yeah, and for instance, we had like in the teaching way before when I came here, I had the crazy idea to actually do some classes online, and people were like, no, this is not this we cannot do that over here. We used to like face-to-face with students. But at the end, everybody loved that idea, and now that's what we do. That's what we do. Yeah, because when you're teaching like adults, you have to actually accommodate. You have to work with them. For instance, if you go somewhere 300 kilometers from Ouagadougou to do a work, and you have a lecture in the evening, how would you manage? Yeah. So we actually developed the opportunity for people to actually be able to take classes online. And what is something positive was the fact that we don't shake hands. It's not like I'm not African. I'm a real African, but not shaking hands help us to like get rid of common colds or other type of infections, because sometimes people, you don't know what people do with their hands. Yeah, so it was like a big relief, because right now we are thinking about how to develop the healthcare system. So if it hasn't been for Corona, maybe that debate would not be possible. Like right now, we are bringing, the hospital have beds and with oxygen for like cases like severe cases and stuff like that. But the beginning of Corona, I don't think the entire country, we have more than 6 beds that can actually help somebody with the breathing issue. We didn't have that. So now Corona, with Corona, we actually put money together. People actually, we had like a fundraising, And people actually put money together, and we help the hospital actually, you know, buy new beds, new equipment that can deal with corona and beyond corona. Yeah, so it's a good thing. I think the disease, and also for us as a, you know, epidemiologist, it will help us actually leave an epidemic, a pandemic, so we know what to do. Because sometimes you learn it from the book, you know, and you don't leave it. This is like one of the lifetime. Maybe after this one, it will take us like more than 100 years to get something like that again. So yeah, so I was not that for people that we lost is not a good thing, but we actually gain something from this, and this is an experience, and the country is well prepared. For instance, if we get a case of Ebola, based on the experience we did with coronavirus, the country knows how to deal with you know, the spread of disease, how we can like actually stop the disease from spreading. So this is like the positive side of it.
Yeah, so it pushed the government, it pushed to look at the healthcare system and to develop it further. Yeah, we have seen that also in many countries in Europe, in Sweden, where we haven't been prepared at all for a pandemic or an epidemic, because we haven't had that for many years. But for example, in Congo, because they are used of the having epidemics all the time with Ebola or other diseases, they already have a system that is there. So they knew how to handle this from the start. But yeah, it's interesting how it can change a lot in a positive way. Crisis doesn't have to be bad all the time. So can you think of anything that could have been done differently in terms of the corona regulations in Burkina Faso?
I think if we had to redo it, the way we introduce the disease in the country, like when I say introduce, like we were hearing about corona, but it's like the way HIV was introduced to the world. Okay, HIV was introduced to the world as men who have sex with men disease. So it kind of made how we deal with HIV difficult, because people view it as a shameful disease. So corona came in as rich people disease, as white people disease. Yeah, so we were not concerned, because every time they were sharing pictures of government officials infected with coronavirus, but none of the people looked like me. They were more like governors, secretary general, and stuff like that. So that's why the regular Burkinabe didn't feel concerned about the virus. So it was something, if we had to do it over, it has to be like a community involvement, okay, getting the community involved. Because people don't actually trust the government. I don't know how it is in Sweden, but over here, people don't trust the government. It was something that you have to work with community leaders and let community leaders actually take over and talk about the disease. So since the government was taking some time to actually communicate around the disease, people were looking for outlet to actually get information. And that's how Facebook kind of picked up on that. So the idea was to have to train more people in the healthcare system on how to communicate around pandemics, and also get communities organized. If we get something like that, let the communities actually handle it. Because we don't trust the government, let the community handle it. They will do a better job compared to what the government has, done so far. And I'm sure the money that we actually closed the largest market of Burkina Faso for about 2 or 3 weeks because of Corona. Without actually consulting the people. But in our tradition, is forbidden to close the market. We only close the market when, the king of the emperor of the Mosi, if we have like a new emperor, like the one we have, passes away or something, that's the only way we can close the largest market. But the government actually dissociated. We did it like Europeans, but we don't have the same tradition. We don't have the same, same way of living. We didn't actually bring the strategy to our reality. We took the strategies used in Europe and we actually applied it directly to the way we deal, to the way Europe deals with Corona. We took it there and we applied it in Burkina Faso and most of the African countries, and it didn't work. It didn't work. That's why at some point people were like, if you don't open up, if you don't open the markets, if you don't open the businesses, it's not Corona that is going to kill us, it's hunger that is going to kill us. Yeah, because in Europe, people were getting help from the government. You get money from the government because you were out of work for like a month or 3. But over here, there's no money that we can, actually share to people to be enough to feed them for the time that we are closed the country. So we took the strategy from outside and we actually applied it to Burkina Faso without taking into consideration the reality of the country. Yeah, so that's, the main thing. If we have to do it all over, we need to think of a strategy that is local, that applies to us. Yeah. Not strategies that, that we imported from somewhere else.
So it has to be adapted. It has to
yes, it has to be adapted. It has to be adapted.
Yeah. Yeah, it makes totally sense. Of course, yeah. Okay. I had another question, but now I don't remember. There are so many interesting subjects to bring up. I don't know if is there anything else that you would like to bring up that you think it's important?
No, what I can bring up is just that, Africa, things are changing in Africa. That's why we have so many talk about, how the relationship between Africa and Europe and Africa and other continents is because we have a new generation. People are actually open up. They have access to information. So the way we deal with the way we used to deal with Africa has to change, and also helping African countries. We have to actually adapt the help to Africa.
Yeah.
Because usually with the way it works, we take a program, for instance, program to actually improve youth education that was conducted in Sweden that works really fine. And we take the program and we bring it to Burkina Faso and we expect it to work. We don't have the same reality. So get the African involved in actually discussing how we're going to manage the program, how we're going to develop the program. So we can actually contribute to giving you the ideas how we can get the program to actually work. Yeah, but what we used to is just program that will come and they will not help anybody. Yeah, so, and you know, public health in Africa needs a lot of work. We need it because, you know, that's the country, Africa is the continent where we need to actually invest in public health, training public health professionals, because we need to focus on prevention. We don't have the money to treat. So we need to stop people from actually getting sick. Yeah, but most of the time we actually build a lot of hospitals, but the hospital is not. Building a hospital is easy, but actually running a hospital is hard because it's expensive. Yeah, but people don't view it that. They think having an hospital is a sign that the government is doing a lot. No, if the government wants to do a lot, is to invest in training people to do prevention, actually helping the communities, to empower the communities so the communities can actually take over the healthcare and not count on the government, because the government cannot have enough money or resources to actually take care of everything. So the communities have to actually take their responsibilities, and it's our job to do that for them. Yeah.
Okay. Interesting. Thank you.
Thank you.
So, okay, so I will open up the floor or questions to the floor. Does anyone have a question? I saw that Mark had a question before.
Yeah, thank you. Thank you for the floor. Thank you, Kaboré, for this interesting information on Burkina Faso experience on COVID-19. And also thank you to Emma for this interesting way of moderating the session. I have a question on the Burkina Faso experience in tackling like the COVID-19 pandemic here. From your, Kaboré, from your intervention, I see that there are like two group of people. From one side, we have like the population that is still skeptical about the vaccine, skeptical about the existence of COVID itself. And the other side, we have like the government and administration that were trying in the beginning to shift like priority from other disease to COVID-19. So what I would like to know from your opinion and from your view and experience is, what are the main major impact of COVID on the other disease, infectious disease and other non-communicable disease in Burkina Faso?
Okay, thank you. That's a great question. I mean, COVID actually impacted, you know, the way we dealt with other diseases. For instance, when COVID struck, we actually had issues with people actually going to the hospital for care. For instance, we take people with asthma, we take people, you know, with diabetes. They were not going to the hospitals because they were worried, like, if you go to the hospital and you catch the COVID-19 there, what will happen is, you know, it's better to stay home. But we didn't have the system to actually, because caring is not, you know, actually, we didn't make it electronic where we can have access to our patients, you know, and like the doctor will stay in his office and actually contact all the patients via telephone or via email or something. We don't have that system. Okay, we're still doing it the traditional way. So we lost a lot of patients because they missed their treatment because they were worried about going to the hospital and becoming sick. Because at some point you go to the hospital, the chances of contracting COVID-19 at the hospital are higher compared to when you stay home. But we didn't have something, we didn't make arrangement for healthcare provider to actually go to patients' home or have a home care system to actually assist. Also, COVID-19, affected the, other diseases. For instance, we started to have like a cholera pandemic, up north. We had cholera pandemic. We were not thinking. We didn't have something. We were not thinking about something like that. But since even the vaccine to go to places and have children to vaccinate, we don't get that anymore because people are afraid of getting out and becoming sick and getting infected. So it affected the how the vaccine rate. It affected the vaccine rate. It affected how we care for people with chronic diseases. It affected, all kinds of, like how the healthcare system works. For instance, you go to the hospital and we didn't have enough space to hold people. At the beginning, we were like, okay, we're treating everybody. When you sick, when you are tested positive, we actually ask you to come to the hospital. We will send an ambulance to take you to the hospital. But we told them at the beginning, but this is not going to work because the hospital would not have enough space. Okay, but after I don't know 2 or 3 weeks, they stopped doing that. If you have like a severe case, that's when they will take you to the hospital. But the beginning, they were taking every infected person to the hospital. But we are people with the coronavirus without any sign or symptom. They're walking like, nothing happened. So those people, they just need to be isolated and keep them like on observant status until, we see the disease go away. Yeah, but, it affected everything, especially for people with the long-term care, like chronic diseases, like it affected those people, especially people with heart conditions and stuff. They were, like skeptical of going to the hospital for care. Thank you.
Thank you.
I also have a question. Thank you, Dr. Kaboré. It was highly interesting to listen to your presentation. I was thinking about, you were addressing the power of the social platforms. What would you say? I mean, you were talking about how to such an extent they were contributing to fake news, theories. How would you propose some sort of regulation of social media? Because we've had the same problem all over the world, I think, to more or less extent, depending on which country. I mean, talking from Sweden, we have it over here, and it's be growing. It doesn't get down. It's actually more conspiracy theories around now than it was 6 months ago. Do you know, has your department or government or anyone in Burkina Faso considered actually contacting Facebook and have a discussion with them on the dangers of the platforms they are actually offering to people?
Okay, thank you. That's a great question. What in Burkina Faso I think we had government official actually contacted Facebook, but it wasn't for that aspect. It was for totally different, because we had people sharing some some hateful information about the government, pushing people to actually go on the street and you know, and disrespect the government. But that was the reason why Facebook was contacted. But my view of it, we cannot stop Facebook or Instagram or TikTok, because right now we have a new one that came in that is like that really went fast and went viral. It was TikTok, and people are sharing a lot of information on TikTok. When you take those platforms, what we have to do is to do a community intervention.
I think, did we lose Dr. Kaboré?
Yes, okay, so it's him.
Yeah. Okay, let's wait. I can't see him online. Yeah, he's still with us, but I can't.
No, he disappeared now.
Yeah.
Okay, he will probably come back.
Okay, I can, let's wait for him, but I can in the meantime recapture a bit, because the reason why I raised the issue on Facebook and all of the social platforms is that I think it's very interesting when he mentioned the strategies of trust and mistrust.
Oh,
Here we
back.
have him again.
Yeah.
Sorry, doctor, we lost you there for a moment.
sorry.
Please carry on. You were talking about TikTok, yeah.
Yes. We actually have to go back to the community, because we need to go back to our tradition, where we actually go to the community and let them organize it and talk. In Burkina Faso, the government was like reluctant about Facebook. Nobody trusted Facebook. But right now in Burkina Faso, every government information, like
Hello?
Yes, I can hear you.
Yeah, okay.
We lost
I think
doctor again, yeah.
Yeah, I think he has a connection problem right now. Let's see if he comes back. Yeah, you can continue, Marie, if you want, about what you were saying. Oh, he's back.
yeah.
Oh, here it is. Yeah.
Hello.
Yes. So the result will be on Facebook. That's why we cannot fight Facebook. We have to work with it. We cannot fight it. We just need to find a way. Even for educating children in Burkina Faso, it's hard, because they get all the information about sex education, like how, you know, they have to manage their sex life, everything they're learning from Facebook.
So do you mean government and the health authorities, are they on Facebook with their messages?
Yes.
Okay, all right.
So it's we cannot fight it. We have to work with it. We have to work with Facebook. We have to actually train people. It's like you have a child, train the child to know the good from the bad. Because everywhere you go, you will find some fake information. You will find, you know, yeah, not everything on Facebook is bad. But how the people can make the difference because between what is good and what is bad is our job to do that.
Yeah, I just find that very interesting because you talk a lot about the issue of trust and mistrust when it comes to the vaccines. As you said, you know, people have been waiting for ages for vaccine against malaria. Suddenly here comes COVID because it's considered a white disease or a disease of the rich. And then you also have the issue of trust and mistrust between people and governments. And for instance, Sweden, our strategy worked precisely because there is a high degree of trust between the people and government.
Yes.
And as you said, of course, that won't work if you take those strategies to a country. You don't even have to think as far as Burkina. You can think England, for instance, where you have such a high degree, and they have to work much harder to convince people to take the vaccines, for instance. And you have the United States, in some states, they even have to pay people, you know, or have a lottery for them to get vaccinated.
Yes.
I just think it's very, very educational for everyone to share this issue of strategies and how dangerous it is to actually believe that a strategy can work all over the place when it's in fact not like that at all. So thank you very much for talking about it. I found it very interesting. Yeah.
Yeah, about giving something there. I think there was one state in the US where they gave a free joint or weed to get vaccinated. I don't remember which one it was, but it was just funny when I heard that. Okay, so does anyone else have a question? No? Okay, so before we finish this session, I would like to ask if it would be okay for everyone to put the camera. If you cannot put your camera, it's okay, but to just take like a group picture. Is that okay for everyone?
I don't have a camera, I'm afraid.
It's okay, it's okay. Okay, so I would just put gallery. Oh! Okay, I will try to take the picture so that I cannot see my phone. Ready, everyone? Great, thank you. Okay, thank you very much for your participation, Dr. Kaboré. It was really nice to have you here and to discuss about public health and corona in Burkina Faso.
Thank you, thank you.
And yes, that was all for today. Thank you, everyone.
Thank you.
Bye-bye.
Bye-bye, thank you.
Thank you very much. Bye-bye. Thank you.
Bye-bye.
Bye.
Thank you.
Thank you.